It's a real privilege to be here. I want to thank Seed and Nahid. I also want to thank the Center for Anti-Racist Research, Hugo. These have been critical partners in the work that we're doing. Um, Today, I want to talk about some of our ongoing work on excess mortality. We're modeling mortality in excess of historical patterns. We extrapolate based on a historical time series, and what we're attempting to add to the literature is looking at areas at small area patterns for U.S. counties, zip codes, and other kind of aggregations. So on the left, we have a U.S. county map for 2020, highlighting the areas with the highest excess mortality rates. And then we pick out some of the particular counties that really stand out as positive outliers. This includes counties in New York and New Jersey that were hit early on, as well as a handful of counties elsewhere that were hit later in the pandemic. On the right-hand side, we look at this question around underreporting of COVID mortality. So this is presenting the ratio of COVID to excess mortality, and the areas in the darkest blue are areas with the most underreporting. There are some parts of the United States where so few of the COVID deaths are reported that the pandemic is effectively being hidden in those areas. And this is not a random distribution. This is in areas that have more Black and Hispanic adults, as well as areas of low socioeconomic status and areas with very weak health systems. So picking out some of the counties with the highest rates of underreporting, a lot of these counties are in the southeast, places like Pines, Mississippi, St. Louis, Missouri, Shelby, Tennessee, which is Memphis, Kansas, Louisiana, Missouri, Florida. So there's a clear regional patterning in the areas with underreporting, and this has, we think, implications for pandemic preparedness and response. There's FEMA programs that are being rolled out to kind of compensate the families of decedents, and none of these programs will work to their fullest capacity unless we have good numbers. From the same preprint on the left, we're looking at the correspondence of COVID and excess mortality. The dashed line is the 45-degree line. If there was no underreporting, most of the observations would fall along that 45-degree line, especially in areas, rural areas in the southeast. We see a lot of the counties fall above that line, suggesting evidence of underreporting. On the right-hand side, we look at the absolute rates of non-COVID excess mortality. These are areas with a lot of hidden deaths. Again, we see Hinds County, we see areas in Louisiana, we see the Bronx, and quite a few areas in the South. Interestingly, there are also areas with negative excess deaths not assigned to COVID. These are areas that had potential mortality reductions during the pandemic that actually may have benefited due to reductions in flu deaths and from other causes. And if you look at this sample of counties that I've picked out here, it's not a random sample. It tends to be areas that are more privileged on average and parts of New England. This is another paper we did in PLOS Medicine where we start to get into factors associated with underreporting. So that first preprint is looking more at regional patterns, whereas here we're looking at factors associated with underreporting, and it's clearly associated with median household income, with racial and ethnic composition, with the presence of comorbidities, and then there's this regional pattern in the South and the West. In another paper in JAMA Network Open, we've looked at healthcare factors. Dying at home increases the likelihood of coroner involvement, and areas with a lot of home deaths had high rates of underreporting. So we think that there are implications here for death investigation systems. A lot of rural counties in the United States rely on these coroners who are elected officials. They have no medical training, and they have few staff to help them adjudicate deaths. Finally, in another preprint, we're looking at racial and ethnic disparities. This is a first step towards a larger agenda with CAR. And we're seeing that there's exceptional increases in non-COVID excess mortality among non-Hispanic Blacks due to diabetes, due to heart disease, and due to external causes of death. These are not being recorded as part of official mortality statistics, but they're clearly present in these populations, and we need to account for these deaths to have a full accounting of the equity implications of the pandemic. Thank you.